The CDC guidelines on what a patient should do when she has close contact with someone who tested positive are confusing. What do you recommend? In August of 2022, the CDC changed its recommendations regarding COVID exposure. The CDC no longer recommends quarantining after exposure to COVID, regardless of the vaccination status. Instead, after exposure, the CDC says wear a high-quality mask for 10 days and get tested 5 days after exposure. You can use the MCN updated flowchart in English and in Spanish to help clinicians communicate what to do after exposure. Guidelines that do not require quarantining after exposure come as a relief to migrant and immigrant patients who may have housing situations that make quarantine difficult, or may have informal work situations that make time off to quarantine or to get tested very difficult. However, with fewer guidelines encouraging quarantine, the risk of exposure, particularly in work situations that make time off to quarantine or to get tested very difficult. However, with fewer guidelines to encourage quarantine, the risk of exposure, particularly in work situations with poor ventilation and few workplace protections, may grow. Talk with patients working on high-risk settings about ventilation, masking, and keeping up to date on community spread.